Welcome to the 2020 Vermont Statewide EMS Protocol Update, Naloxone Leave Behind Overdose Rescue Program. Naloxone Leave Behind Overdose Rescue Program, also known as the Naloxone Leave Behind Kit for short, is a new protocol to help address the opioid epidemic. The opioid crisis is a growing concern in America, and it has become the leading cause of injury-related death in the United States. Naloxone is an opioid antidote that reverses the symptoms of opioid toxicity and associated life-threatening respiratory depression. Providing naloxone leave-behind kits containing naloxone to patients who have just had an overdose or who have other signs of opioid use disorder, OUD, has been shown to save lives and is a critical intervention EMS can deliver. The purpose of the program is to provide individuals who have just experienced an opioid-related overdose or who have other indications of OUD, also known as an at-risk person, with an naloxone leave-behind kit, along with instructions on harm reduction and how to access treatment, in order to potentially prevent a future opioid-related death. Indicators of opioid use disorder may include patient endorsement of OUD, concern expressed by family members or others on scene, presence of drug paraphernalia, or clinical signs and symptoms. The procedure is as follows. Identify an at-risk person who has experienced an opioid-related overdose or has indicators of OUD. Complete usual patient care as per Vermont statewide EMS protocols. Overdose patients who received naloxone by EMS or prior to EMS arrival by first responders, family, or bystanders should be encouraged to accept transport to the emergency department. Offer a naloxone leave-behind kit to an at-risk person if they refuse transport. Additionally, offer a kit to an at-risk person that has not experienced an overdose but has indications of OUD. The naloxone leave-behind kit may also be given to family members, friends, or other persons on scene who are in a position to assist the at-risk person. Provide instructions on how to use the naloxone leave-behind kit, along with harm reduction instructions and the information handout on how to access treatment for OUD. Patients who use naloxone on scene prior to EMS arrival may be offered a replacement overdose rescue kit. This is a copy of the brochure or wallet card that is included with the naloxone leave-behind kit. Review the information on this card with the at-risk person and/or others on scene. Follow standard protocol and contact medical direction for patients who wish to refuse transport. For documentation, in Siren, under Provider Action Treatment, document if a naloxone leave-behind kit was given. If the kit was offered but not left behind, briefly document why. Dispensing a naloxone leave-behind kit is an approved activity under Vermont EMS scope of practice for all provider levels. The proper documentation site in Siren can be found by going to Provider Action Treatment. If the naloxone leave-behind protocol is utilized, please complete the following 3 questions. If an at-risk person was identified, was a naloxone leave-behind kit left with a person on scene? Answer yes or no. If yes, document the number of leave-behind kits distributed at the scene. You may leave more than one depending on the circumstances. If a naloxone leave-behind kit was offered but not left behind, please document why. For example, you may document the patient refused or the patient already had several additional kits available. Distribution of naloxone leave-behind kits is a critical intervention EMS can perform. Providing at-risk persons who refuse transport with the naloxone leave-behind kit will save lives. Contact Stephanie Bush in the Vermont EMS office for additional information on the program and to obtain replacement leave-behind kits. This concludes the training module on the 2020 Vermont statewide EMS protocol update for the Naloxone Leave-Behind Overdose Rescue Program.